Hello juniors, I welcome you all again in the continued series of upper limb, and today we'll be covering the topic flexor retinaculum. It's a short topic yet an important topic from university point of view. So in today's topic of flexor retinaculum, we'll be covering general about flexor retinaculum, its attachments, its relations, and its clinical correlation. Showing you what flexor retinaculum is. When you will go in your dissection hall and you will dissect the palm, you will see this white fibrous band over your wrist here. Once you will dissect the palm, you will find this white fibrous band, and this is nothing but flexor retinaculum. Showing you once again, this is our flexor retinaculum. General about flexor retinaculum. As the name suggests, flexor present at flexor department or side of arm, that is nothing but anterior side of arm, anterior side of forearm. And retinaculum means in Latin to means hold back. So what flexor retinaculum does, it hold backs the tendon of various muscles. It's a, as already said, strong fibrous band bridges the anterior concavity and forms the tunnel. This is what I was trying to show you. This band forms a tunnel. These are the carpals, and this concavity forms a tunnel between this retinaculum, flexor retinaculum, and between the carpals a tunnel is formed, which we'll discuss later. So this band bridges the anterior concavity and forms the tunnel. Then in general, now covering the attachments. Showing you this diagram I have taken from BDC. Here this is medial side, here lateral. So medially, this fibrous band, which we are calling flexor retinaculum, is attached to pisiform bone and hook of hamate. Medially it is attached to pisiform bone and hook of hamate. Laterally it is attached to tubercle of scaphoid bone. This is our scaphoid bone, and crest of trapezium. This is our crest of trapezium bone. Showing you once again. So this is our flexor retinaculum. Here it is medial side, here it is lateral. You should once view all this. Here it is medial, here it is lateral. So medially, here it is attached to pisiform bone and hook of hamate. As you can appreciate, this is hook of hamate and this is pisiform bone. Short bone, pisiform bone. Laterally we have tubercle of scaphoid. This is our tubercle of scaphoid, and this is crest of trapezium. So band have medial attachments and lateral attachments. Now here there is a one extra thing, that there is a lateral deep slip and medial superficial slip. So what are these slips are? These slips are an extra growth of this fibrous band. There's nothing about lateral deep slip. What are they trying to say is, there's one extra growth which they named as lateral deep slip. This was our main flexor retinaculum, and a extra growth, this one, they named it as lateral deep slip, which attaches to medial lip of groove of trapezium. This attaches here. This is medial lip of groove of trapezium. In the same way, there is one more outgrowth which they called as medial superficial slip, also known as volar carpal ligament. It is attached to pisiform bone. This is attached, showing you this is nothing. What they are trying to say is this is lateral deep slip. This is outgrowth from main flexor retinaculum, that is lateral deep slip, and medial superficial slip is not mentioned in this illustration, so nothing much about this. So what you have to grasp from this is these two slips form another tunnel. You can see this is one more space is formed, triangular space, and here one more space is formed. These two tunnels also have some contents in them. So done with the attachments, we are done with general attachments, and now coming to the relations. We will do relations with the help of by taking this diagram. So firstly, we will divide the relations into parts, which are structure passing superficial to flexor retinaculum and structure passing deep to flexor retinaculum. So firstly, showing you with the help of other illustrations. So once you will dissect the wrist in dissection hall, it will somehow look like this. This is our flexor retinaculum, and we will going to cover relations on the basis of contents below flexor retinaculum and above flexor retinaculum. So the contents below flexor retinaculum are mentioned here, which are, these are 4 tendons of flexor digitorum superficialis muscle, 4 tendons of flexor digitorum profundus muscle, flexor digitorum profundus muscle. Now you can start drawing along with me. Here there were 4 tendons of flexor digitorum superficialis muscle and 4 tendons of flexor digitorum profundus muscle. One here median nerve goes from here. These I am drawing the. These are 4 tendons. And what I am drawing, this is bursa. This is bursa. What bursa means? Bursa is a fluid filled sac which mainly help to overcome the friction. As you can see, there are 4 and 4, total 8 tendons here below the flexor retinaculum in a closed space. So to decrease the friction between them, there is a bursa, showing you in one of my illustration. As shown, these are the 4 tendons. You can see, appreciate this blue covering over them, covering over the tendon. So these are the bursa which counter the friction between these 4 tendons. And here I have one more tendon of flexor pollicis longus, flexor pollicis longus, and its bursa. So what is bursa? Bursa is a fluid filled sac around the tendon, over the tendon, which helps to counter the friction. Done with the content below the flexor retinaculum. Now I'll be covering contents above the flexor retinaculum. Firstly, I have this palmaris longus, tendon of palmaris longus muscle. Done with palmaris longus, I have median nerve, division of median nerve, which is palmar cutaneous branch of median nerve. Here I have palmar cutaneous branch of ulnar nerve, and here I have ulnar vessels. We will once again cover all this, and here I have the flexor carpi radialis muscle and its bursa. I know here it is getting a little bit all at a time. So structure passing superficial to flexor retinaculum. Once we now, along with diagram, I am explaining to you. Structure passing above the flexor retinaculum are, this is our palmaris longus, tendon of palmaris longus muscle. This one is our median nerve, which is going beneath the flexor retinaculum, but its branch, palmar cutaneous branch of median nerve, is going above the flexor retinaculum. Here I have palmar cutaneous branch of ulnar nerve, and I have ulnar artery and nerve. So these four things I have in superficial compartment, which are palmaris longus tendon, percutaneous branch of median nerve, I should say palmar cutaneous branch of median nerve. Thirdly, I have once again palmar cutaneous branch of ulnar nerve, and lastly I have ulnar nerve and vessels. In vessels I have artery, ulnar artery and ulnar nerve. So done with the structures passing superficial to flexor retinaculum. Now structure passing deep to flexor retinaculum. As I have already discussed, here I have tendon of flexor digitorum superficialis. How many tendons? I have 4 tendons. Now tendon of flexor digitorum profundus. How many tendon? 4 tendon. As these names suggest, flexor digitorum profundus, superficialis and profundus. I'll tell you what they mean. Flexor means they help in flexing the hand, Digitorum means they are connected to the digits of our palm, and superficialis, these muscles are in the superficial area of our forearm and wrist. Here flexor, once again flexing, digitorum connected to digits, and profundus, that is lying, they are lying deep in the flexor compartment. They were superficial, they were deep, both were 4-4. Both they are related bursa. Thirdly, I have median nerve, and fourth I have flexor pollicis, tendon of flexor pollicis longus, and its bursa called as radial bursa. This one more content left, which is the flexor carpi radialis. And its bursa. So I have made an illustration for you for your better understanding and simplification, made on a glove. I have made this for covering the superficial content above the flexor retinaculum. Starting from, once again, we have medial attachment as pisiform bone and crest of hamate. Here I have medial side. Laterally it is attached to trapezium and scaphoid muscle. Now superficially I have palmaris longus. So this is the tendon of palmaris longus. You can appreciate this is our flexor retinaculum with brown color. This is going above the flexor retinaculum. This is palmaris longus. This is palmar cutaneous branch of median nerve from yellow, depicted from this yellow color. Palmar, as you can appreciate, it is also going above the flexor retinaculum, and when we trace it backward, it's joined to the its main median nerve. This is our median nerve, which is going deep to the flexor retinaculum. I hope you can appreciate. This is palmar cutaneous branch of median nerve, and when we trace it back, it goes and merge with its parent nerve, median nerve, which median nerve goes beneath the flexor retinaculum. This is our median nerve. As you can see, this is the median nerve. This is palmar cutaneous branch of median nerve, palmaris longus, and same here, palmar cutaneous branch of ulnar. This is palmar cutaneous branch of ulnar nerve. Then beneath the volar carpal ligament, that is nothing, our medial superficial slip. So between this slip I have ulnar artery. This is the ulnar artery, and here I have the ulnar nerve. I hope you are able to appreciate and able to see what I am trying to show you. So done with the attachment relations. Now we are doing the clinical correlation. For clinical correlation, we have carpal tunnel syndrome. What is syndrome? Syndrome is a group of diseases, group of symptoms. In carpal tunnel syndrome, numbness and tingling sensation in the hand and arm caused by pinched nerve in the wrist. Showing you. This is carpal tunnel syndrome. When the nerve going beneath the flexor retinaculum are compressed or pinched, like here the median nerve is pinched by compression, so a numbness or tingling sensation is felt in the wrist, in the palm, that is known as carpal tunnel syndrome. Hope you have liked the video, hope you have understand the topic, and I always say the anatomy is as simple as that if you once visualize and start preparing anatomy as I make you understand. Thank you.